And we're back with our guests today from Saddleback Memorial Medical Center, and a repeat guest on the program today, Patricia Dooley, Director of Volunteer Services. Welcome to the program. Again, good to have you with us. And a new guest today, Sherry Taylor, who is the Compassionate Listener Volunteer. Sherry, welcome to you as well.
Thank you.
We're going to learn about that program today, the Compassionate Listening Program over there at the hospital. A little bit of outline how this got started.
I think, basically we're always looking at ways to improve our service to our customer, which is our patients and families, and having a chance to, listen to different staff issues. I was able to, hear that this was a need, and so as a result, we were able to kind of look at what ways we as volunteers could make a difference, and we felt that we had the gift of time. That was something that we had, unlike staff members.
Right. Okay, now, Sherry, you've been involved as a volunteer over there. A little bit about the background and training that goes into the program?
Well, there is specialized training class, and also there's a mandatory monthly mentors meeting to go to, and then they're also looking to for volunteer for the 4 hours to do that.
Well, Patricia, this sounds like a unique, interesting program, and this is done in the hospital, right?
Correct, yeah. Basically, it's our staff, starting with our RNs, that are actually making the referrals to us. However, it's open to any other ancillary services, therapists, so on. And the thinking is that, they're with the patient, they're kind of identifying the patient that might not have a visitor. Or maybe it's that person that's a little anxious, a little stressed, because hospital is very stressful. Yeah. And if we could go in and just spend a little bit more time with them and just kind of, ease them a little bit, and then possibly, if there is an issue, make sure that it gets, handled and give it to the appropriate person.
The reality is that the doctors are very, very busy. The nurses and technicians are very, very busy, seeing maybe dozens of patients in a day. Exactly. They care, they're all compassionate, they all want to do a good job for the patient, but they really don't have the time. If they spend an extra 5 minutes talking to that person, that takes time away and that backs up their schedule for the rest of the day, whether it's a doctor or a nurse or a technician.
Absolutely.
So this fills that niche of someone to talk to without really inhibiting the medical procedures that are going on over there. Sounds like a really, really good program indeed. Now, this is done just in the hospital. You don't follow people home and
That's right.
after that.
Just right in the hospital.
Right, right.
Yeah.
Some of the requirements for people to get involved?
Well, typically, if you're interested, what we'd like for you to do is come to an orientation/training, see if it's for you, and then if it looks like it's a good fit, because really you have to have that special gift, that ability to really be with someone and be present. That human-to-human contact. If it feels good and through some of our role playing, you feel comfortable, then we would invite you to go through the normal process of becoming on board as a volunteer, which would be, an orientation. You must be, this program we're looking at 18 and over.
So Sherry, they don't just throw you in, unlike this morning where they threw you on TV. They don't just throw you in and say, oh, go talk to the person in Ward B5.
No, we do have that training program, which was really good, and you went ahead and we did some role playing, and that way you felt comfortable. So when you went to talk to the first patient, it was easy and you were prepared.
Right.
Yeah.
What kind of response do you get from the patients? Because they're used to seeing, the doctor's going to come in with the stethoscope and the white coat and say, how are you feeling? Listen, look at the chart, make some notes, say, have a good morning, we'll see you later. The nurse may come in, give a shot, fluff your pillow, technician may roll in some equipment, do a test, they're in, they're out. You're in there for a lot longer, a few more minutes, and what are some of the responses you get from the patients?
They're happy to see a different face and somebody that really is there just to listen while they talk and share whatever it is that they might want to share.
Right, good.
Yeah.
And then do you ever interact with the family as well? Say you're in the middle of visiting somebody, their family comes in, do you have a chance to talk to them as well a little bit?
Yeah, what you do is you just kind of let them know who you are and that you were talking, and then you kind of politely excuse yourself unless they say, oh no, we're just here for a quick second or whatever.
Right. Well, obviously you're identified by wearing the shirt that says you're a
Yes.
volunteer as well, so that
Yes.
identifies you as somebody who isn't just somebody that walked in off the street to talk to your mom or dad.
Right, exactly.
That's great.
And we also leave a little card with our name on it that says that we were a compassionate listener from that program.
Now, it may be that you're visiting somebody today, maybe tomorrow somebody else is going to visit them, so they may get to know more than one person that way.
Oh, absolutely.
Right,
Right.
right. Do you try and put ladies with ladies and gentlemen with gentlemen,
No.
or just whoever happens to be available?
It's whoever, right.
Yeah.
Right.
And is there a regular shift, Patricia? Do they work a certain number of hours?
Well, our goal is, since we're kind of building this up, our goal is to have 3 shifts, an 8 to 12, 12 to 4, and then a 4 to 8 shift. And we're presently just on the medical surgical unit. However, our hope and goal is to expand it hospital-wide. So potentially, you know, we could look at 3 or 4 people per shift,
Right.
which would be, you know, quite a bit. But I think it's something that we could really make a difference with.
Great. Sounds like a very important program indeed, and again, something that maybe some of you folks would like to get involved in. Basically, if someone's a good listener, has a few hours to donate, take the training class, see if it works for them, and go from there. And just one more of the good services the hospital provides. You know, obviously you're dealing with a variety of issues. Obviously the medical issue is number one reason. Getting them well enough to leave and either go to an interim facility or head for home. But along the way there's that need to talk to somebody sometimes as well. Does this sort of interrelate, or the hours that you're having your staff on duty kind of relates to when the visiting hours are at the hospital? Is that sort of about the same times?
That's right,
Yeah,
So we're trying to coordinate that. If we find we need to expand it later, we can look at that, but right now we're just kind of sticking with those hours.
Right.
It's kind of a new program, and we're definitely looking to expand, so if you are interested, that would be wonderful.
And then Sherry, I guess if somebody really shares a concern with you, they go, you know, the doctor's not really telling me the results of my tests and I really want to know, or, you know, the nurse gave me this injection, I have no idea what it was. Can you kind of follow up with the staff and say, you know, this person needs to maybe have a little more information about what you're giving them and why and what the treatment program is?
Absolutely. That's exactly what we do, so that they're made aware of the patient's concern.
Right. So it's kind of an interim way to talk to the doctor without having to yank on his white coat and say, hey, by the way, what's going on here? So that communication is good, and that sometimes maybe people will be freer to talk with you than they would with maybe somebody in an authority figure, doctor, nurse, or technician in the hospital. So it's like a good program.
A little byproduct too is that we can actually support our staff by acknowledging those that are doing that. So, you know, through this we can kind of identify some staff, and then, you know, we can look at system-wide, see how and what changes we might need to make.
That's great.
To improve. So.
Sounds like a great program indeed. And again, you know, while you have a state-of-the-art medical center over there and all this high-tech equipment and well-trained physicians and well-trained staff and all, it's good to know that there's a human touch is there as well. I remember several years ago reading a book that talked about high-tech but high-touch, really important for all of us in our society today. We thank you both for joining us, especially thank you for volunteering your time. That's super. Yeah. You'd like some more helpers, I guess, to help you out volunteering.
Absolutely.
Yeah, that's great.
That would be great.
Get them through the training program and get them up to speed and get involved there. We thank you both for joining us on the program today. Continue good success. Again, that's the Compassionate Listening Volunteer Program, and we've been talking today with Sherry Taylor, one of the volunteers, and of course Patricia Dooley, who's the Director of Volunteer Services over at the Saddleback Memorial Medical Center. Lots of good ways you can get involved over the hospital. Of course, you can make your donations. You can also get involved as a volunteer at varieties of levels as well. We'll be coming back with more right after this.